I'm from North Alabama, Decatur, Alabama, and my father was a general practitioner. And one of his best friends was a general practitioner who got tired of doing that and went back and became a urologist. And he moved back to Decatur. And as he found out I was in pre-med, he just said, "You need to think about urology." And this was before I even started medical school. And I liked him, I respected him, I know my daddy did. And so that's what I really considered. And when I realized that urology is a surgical specialty, but it also allows you to see patients, so it's kind of a good mixture of both, and that's what I decided to do. So I've been in actual practice since 1974. I joined Norwood Clinic at Caraway, where I trained and did my residency under Dr. Henry Hudson. And as I've practiced urology, things have changed greatly. Early on, it was open surgery, nearly everything. And now we've changed to the robot and laparoscopy and using lasers. And people used to stay in the hospital for weeks at a time. Now nobody ever stays in the hospital more than a day, just about. And so it's been a real dramatic change. I'm director of clinical research, and I have 3 full-time nurses that work with me. And the patients seem to really be very happy that we're able to offer them other options if their surgery and or radiation or whatever therapy they've had is not working and it's obvious that their cancer has not been cured. And so that's one reason we do this, and it keeps us up to date on the newest treatments available, and therefore we've already had experience with them when they come out, and if I already have confidence in them, I'll go ahead and start using them early, whereas a lot of doctors will wait a year or 2 years before they try something new. I'm also in charge of the erectile dysfunction department, and I have 4 full-time ladies that work with us back there, and they just do a fantastic job. They have amazing experience, and they do such a good job of making men feel comfortable. And there's a problem called Peyronie's disease, which is a very difficult thing to treat, and a lot of urologists don't like to treat that. And so we've taken on that particular niche and are very excellent at treating this. And Chris Spivey, who's in our group, a surgical assistant, has so much experience in this, and she's taught me a lot about Peyronie's disease that I didn't know while I was in general urology practice. And so we see people from multiple states, that come here because they've heard of our expertise or they've seen it on the website. I'm retirement age. I could retire if I wanted to, but the more I thought about it, I just wasn't ready yet. And my call schedule is not as severe as it once was when I was in a 3-man group, and so you're not as tired. You have more energy, and I enjoy seeing the challenges of a new patient. And in research and ED, we're helping people that have a major problem that they're very concerned about. And so it's very gratifying to be able to see that you've really helped somebody in need. I think I've still got a lot more to offer, the patients in our region in Alabama. And in the areas I'm in, we see patients from several states around Alabama. We're just not an Alabama-based practice. And we even see people from out of the country who come in here and have robotic surgery, and then they maybe see us later, for other problems after that. So I traveled all around the country giving lectures on the holmium laser and the techniques and proctoring doctors, on how to do that. And I really enjoyed doing that, and I got to meet doctors from all over the United States, and I really enjoyed that very much. But here we're one of the world leaders in robotic surgery. And I've gone and watched the doctors operate. I've seen how good they are. If somebody goes on the website and sees my name, I just hope that he's going to associate me with quality, and that I'm going to spend my time, and I'm not going to be in a hurry, and I'm going to listen to to his complaints, and I'm going to ask the appropriate questions, and I'm not going to cut him off, and that I'm going to do everything I can to solve his problem.